My name is Atlee Shaw, and I'm going to discuss the Stay Steady Primary Prevention Program. The Stay Steady program is a DMP-led primary prevention program aimed to prevent falls in the older adult population. This slide lists the objectives for the presentation. For this presentation, older adults refers to an adult who is 65 years of age or older. The World Health Organization defines a fall as an event which results in a person coming to rest inadvertently on the ground or floor or other lower level. Falls are a major public health issue in the older adult population and are the leading cause of fatal and non-fatal injuries in older adults. 1 out of 4 older adults will fall each year in the United States, making falls a public health concern, particularly among the aging population. Falls are a huge threat to the older adult population's safety and independence, and generate enormous economic and personal cost. More than 3 million injuries related to falls are treated in the emergency department every year, including over 800,000 hospitalizations. Falls are one of the most common and serious problems in older adults. According to the CDC, about 36 million falls are reported among older adults each year, resulting in more than 32,000 deaths. In 2021 alone, 38,742 older adults aged 65 and older died from preventable falls, and nearly 2.9 million were treated in emergency departments. While preventable, falls in the older adult population are on the rise. Over the past 10 years, older adult fall deaths have increased by 60%, while emergency department visits have increased by 20%. I obtained this chart from the CDC website. As you can see, death from falls in the older adult population is at an all-time high. This chart shows death rates caused by falls by month from the years 2018 to 2023. Each year has a different color line with the color chart shown on the right. As you can see, death by falls has increased steadily year by year. This is a sad statistic, as falls are preventable, and although the changes that come with aging do place an older adult at increased risk for falls, falls itself are not a normal part of aging. Risk factors that put an older adult at risk for falls can be intrinsic or extrinsic. Intrinsic risk factors are factors specific to a person that place them at higher risk for a disease or condition. Extrinsic risk factors are factors that influence externally and are modifiable. Here are some examples of intrinsic risk factors that place an older adult at risk for falls. Although falls are preventable, many changes that occur with aging place an older adult at risk for falls. Advanced age is a main risk factor. This risk factor is due to physical, sensory, and cognitive changes associated with aging in combination with environments that are not adapted for an aging population. Research shows women fall more frequently than men and have a higher rate of non-fatal fall injuries. While women fall more frequently than men are more likely to pass away from a fall-related injury. This difference could be due to the fact that when men fall, they are typically older than women when they fall, and the chance of injury-related death increases with age. Previous falls are a major risk factor for future falls. According to the CDC, research shows falling once doubles the risk of falling again. Another risk factor that places the older adult at risk for falls is vision and hearing impairment. Visual impairment is the third most common chronic medical condition in older adults, affecting an estimated 10% of people over the age of 65 and 20% of people over the age of 75. Hearing loss is common with advanced age and greatly influences the older adult's risk for falls. Hearing loss can lead to being less aware of things going on in the environment around them and also lead to balance and gait problems. Chronic health conditions such as osteoporosis, sarcopenia, dementia, and Alzheimer's, problems with blood pressure, obesity, weakened muscles due to aging, and many other health conditions can contribute to an older adult's risk for falling. Fear of falling is another factor that increases the risk for falls. Older adults may avoid physical and social activities because they are afraid they might fall. That can lead to muscle weakness, social isolation, anxiety and depression, and all of these factors can increase the risk of falling. Now we will talk about extrinsic risk factors for falling. These are risk factors that are caused externally from the person from things in the environment. These are controllable risk factors. Extrinsic risk factors for falls are things such as clutter, inadequate lighting, throw rugs, uneven or wet floors, such as raised thresholds, unstable or lightweight furniture, insecure toilet seats or handrails, hard to reach personal items, lack of handrail support in bathrooms, stairs, and medications. Educating older adults about these modifiable factors that place them at an increased risk for falls is essential to decreasing falls in this population. There are 3 different levels of prevention: Primary, secondary, and tertiary. Primary prevention can be defined as the process of altering susceptibility or reducing exposure to susceptible individuals and includes general health promotion and specific measures designed to prevent disease prior to getting the disease. This level of prevention is focused on preventing the disease or condition before it takes place. Education is a primary focus for this level of prevention. Secondary prevention is aimed at early detection and prompt treatment of a disease at the earliest possible stage. Secondary prevention involves screening and detection. Tertiary prevention involves implementing strategies during the middle or late stages of a clinical disease and refer to measures taken to alleviate disability and restore effective functioning. This level of prevention is aimed at rehabilitation and treatment. Primary prevention for falls in the older adult population is aimed at preventing falls before they occur. This will involve education about falls and the risk factors for falls, exercise, strength and balance training, vision and hearing impairment interventions, and managing health conditions that place an older adult at risk for falls. Another main intervention is modification of the home environment. This includes things such as getting rid of clutter and throw rugs, having adequate lighting, even floors, stable furniture, and installing handrails and grab bars in necessary locations. Older adults should also be educated on the importance of adequate footwear, such as closed-toed shoes that fit properly. Adequate footwear plays a huge role in fall prevention. Secondary prevention of falls involves fall risk screening and identifying patients at risk for falls. This can be done by getting a physical examination done by a healthcare professional to assess and identify health conditions that place an individual at risk for falling. Vital signs, blood work, neurological screenings, hearing and vision screenings, and review of current medications are ways to screen for falls and fall risk. Fall risk questionnaires can be done to identify risk for falls in the older adult population so appropriate interventions can be implemented. Tertiary prevention for falls focuses on the care of the individual after a fall has occurred. The aim of tertiary prevention is to reduce disability and treat injuries after a fall has occurred in hopes to restore previous level of function and health instead of the patient experiencing further physical decline. The objective of the Stay Steady Primary Prevention Program is to provide education and evidence-based interventions that are aimed at preventing falls in the older adult population. This is a primary prevention program. The goal of this program is to prevent falls before they occur. Primary prevention is aimed at taking measures to prevent a condition or disease before the occurrence of it. The Stay Steady Prevention Program will consist of developing and handing out a pamphlet and classes which will consist of education and exercise and balance training. Classes will be held every first Tuesday of the month from 10 to 12 at the local community center and every first Tuesday of the month from 2 to 4 at the local senior living center. An educational pamphlet will be developed by the DMP that will consist of a home fall prevention checklist. This pamphlet will be given out at local doctor's offices, pharmacies, and rehabilitation centers in hopes that older adults will be able to recognize things in their home that place them at higher risk for falls and make adjustments before falls occur. Flyers will be made to advertise the class at the community center. Anyone is welcome to attend. These flyers will be posted in various public locations that are popular among the older adult population. The DMP will be responsible for reaching out and partnering with local doctors' offices, pharmacies, and rehabilitation centers so they can promote participation in the class and pass out flyers. The DMP will partner with the local senior living center and encourage the staff members to promote participation in the class. With one of the classes being at the senior living center, participation is likely. The class will be a fun, educational, and social event for the older adult population right where they live. The DMP will recruit local nursing programs to participate in the classes. Nursing students will be expected to present a visual presentation to the group, which could be done by PowerPoint, poster, or any other visual presentation form. These presentations will be educational presentations about what places an individual at risk for falls and ways to prevent falls. The nursing students will be expected to pass out a handout at the end of the presentation highlighting key points. A physical therapist will then engage the class in strength, balance, and gait exercises. Studies show exercises that target muscle strength, balance, and gait help to prevent falls in the older adult population. Nurses and nursing students will assist with these exercises that are led by the physical therapist. Nurses will be expected to assess participants' health status during these classes. Written surveys will be passed out and completed by the participants at the end of the classes. A big part of the Stay Steady program will be the pamphlet made by the DMP. This pamphlet will be a home fall prevention checklist and include topics such as floors, lighting, stairs and handrails, throw rugs, clutter, cords, and keeping personal items within reach. These pamphlets will be passed out at doctor's offices, pharmacies, and rehabilitation centers, and the monthly classes in hopes to raise awareness about falls and ways to prevent falls in the home. The interdisciplinary team will consist of the DNP, nurses, physical therapists, primary care physicians, and nursing students. The DNP plays many roles in the implementation of the Stay Steady program. Through their extensive education and experience, they will be able to lead and facilitate the program. They are responsible for recruiting nursing programs and students and other interdisciplinary team members to participate in the program. The DNP will develop the fall prevention pamphlet, which will be a huge asset to preventing falls in this population. The DNP is equipped with the skills and knowledge to collect and analyze data. Collecting and analyzing fall rate data is a very important job for the DNP, as the data will be an indicator of whether or not the program is successful at preventing falls in the older adult population in the community. The DNP will educate the interdisciplinary team and the participants throughout the program. Nurses will assist the DNP with tasks and planning for the Stay Steady program. They will assist with exercises led by the physical therapist and use their assessment skills to monitor participants' health status during the classes. The physical therapist will plan and lead the group in strength, balance, and gait exercises. The role of the primary care physicians is to encourage participation in the classes, review patient medications, and identify medications that place an individual at high risk for falls. They will provide education to participants about their medications and health conditions that possibly place them at higher risk for falling. Nursing students will be responsible for presenting educational presentations to the group, provide handouts, and assist with exercises. The American Nurses Association provides a list of leadership competencies necessary for nurse leaders to exhibit. 4 leadership competencies that the DNP must have in order to successfully plan and implement this program are communication, change, project management, and vision and strategy. I will go over each of these leadership competencies in more detail. Communication is a leadership competency that the DNP must have in order to successfully implement the Stay Steady program. As the leader and facilitator of the Stay Steady program, the DNP must be able to effectively and efficiently communicate with the interdisciplinary team. The DNP is responsible for communicating with various groups and responsible for delegation of tasks and expressing new ideas to the team. Another leadership competency the DNP must possess is change. A role of the DNP in the program is to assess the need for change and be passionate about the need for change in order to effectively facilitate change initiatives. The DNP should lead by example, be open to change where change is needed, and be able to change their role as needed within the program. Project management is another leadership competency the DNP should possess. As the overseer and project manager, the DNP must be able to organize and lead the change program and delegate tasks to other interdisciplinary team members. Another leadership competency important for the DNP to have is vision and strategy. The DNP must be able to recognize the need for change where change is needed and translate their vision for change into a strategic and effective change program. The DNP is responsible for the development and implementation of the change program. How will we know if the plan is successful? One way to evaluate effectiveness of the program is by getting the participants to complete surveys at the end of each class. The participants will be asked to state if they have had any falls in the past 6 months and any falls since attending the class. They will be asked if they feel the program is educational and helpful. Participants will be asked to list at least one safety change they will make in their home to reduce their risk of falls. The DNP is equipped with the knowledge, skill, and educational background to be able to collect and assess data. A role of the DNP will be to collect and assess fall rate statistics within the community, comparing rates from before and after the pamphlets were made and given out and before classes began. The DNP will consult with the staff at the local senior living center to view fall rates before and after the class was initiated. In summary, Stay Steady is a primary prevention program aimed to reduce falls in the older adult population. Falls are a leading cause of injury and injury-related death in older adults. Older adults frequently lack education about falls and are unaware of their personal risk factors. By implementing education and educational programs to the older adult population regarding falls, the DNP can ensure that the older adult population is receiving education and opportunities to prevent falls. Primary prevention is key for this health risk in the older adult population. Educating and providing classes to this population will potentially result in a decrease in the number of falls in the community, leading to healthier lives and improved health outcomes for this population.